So today what we're going to talk about is insulin resistance, because that's really the heart of type 2 diabetes. And this is my disclosure, so I don't really have any commercial interest. So type 2 diabetes is a really important disease because it causes most, or is associated with most of the diseases that we care about today, which is heart disease, cancer, Alzheimer's disease, and so on. But we really have to think about this insulin resistance in a new paradigm, because the one that we've been taught, the one that we understand, actually isn't the one that's really true. And so type 2 diabetes is a disease with two phases, right? So there's, if you look at the time course of the blood glucose before the diagnosis of type 2 diabetes, there's actually two phases. So there's a long, slow phase where the blood glucose rises very, very slowly, and that's where the insulin resistance is rising, okay? But the body produces enough insulin to overcome this resistance. So the blood glucose stays relatively normal. It's compensated, right? So it's called a compensatory hyperinsulinemia. At some point, the pancreas doesn't produce sufficient insulin. Either the insulin resistance is too high or the amount of insulin drops. So because you lose this compensation, the blood glucose goes up and type 2 diabetes is diagnosed. But that's relatively late in the game. The slide shows you that even up to 14 years prior to the diagnosis of type 2 diabetes, you get this rising insulin resistance. So you can see this when you look across the spectrum of lean people and obese people. Then as they develop more and more prediabetes than diabetes, the insulin resistance goes up and up. And this is a slide of the beta cell. So the beta cell in the pancreas produces insulin. And this is the black circles. You can see as you go across the spectrum from normal to obese to prediabetes to diabetes, insulin production initially goes up. So as you go to the middle, the black circles, you can see that it goes up, but at some point it drops. And the white circles is the blood glucose, and you see as the insulin production drops, the blood glucose goes up, and you make the diagnosis of type 2 diabetes. But the key problem, there's two key problems, right? Insulin resistance and the beta cell dysfunction. And for this reason, people tell you that the beta cells are burning out, right? And that's why type 2 diabetes is chronic and progressive. And eventually, you take medication, then you take insulin, then you take more insulin, then more insulin, more insulin. And that's the way we tell people to think about type 2 diabetes. Unfortunately, it's not really true. So the key is to understand what insulin resistance actually is. Okay, where does it come from? How does it develop? So in order to understand insulin resistance, you've got to think about what insulin normally does. So when you eat food, insulin goes up, right? Insulin basically tells the body that food is coming in and you should store some of it. So you store sugar in the liver, which is glycogen, and you store fat also. So if you eat too much carbohydrates, then that is going to be produced by a process called de novo lipogenesis into fat. And when you don't eat, which is simply called fasting, right? That's just the flip side of eating. When you don't eat, insulin falls. And as it falls, it tells your body to pull some of that sugar and pull some of that fat back out of the system. So as long as you balance your feeding and fasting, you got a well-balanced system. You don't actually gain any weight, right? Because you eat, you store sugar. You don't eat, you fast, you burn sugar, right? That's basically all it is. So insulin does a couple of things. So it lets all the glucose into the cell, but it also produces this new fat, right? That's the de novo lipogenesis. So there's two functions, not simply one. And this is the way we think about about insulin resistance. It's this lock and key paradigm, that insulin acts like a key on the cell. So this is, for example, a liver cell. So you have receptors, which is like a lock. When insulin is produced, it opens the gate, and it lets all the glucose in. So what we tell people is that insulin resistance is actually a state where this mechanism, this lock and key paradigm, is completely gummed up, okay? So it's not that the lock is defective or the key is defective, because you can easily sequence the insulin or the insulin receptor. They're normal. But something is gumming up the system, so all the glucose stays outside, and the cell faces this state of quote-unquote internal starvation, right? Because it can't go in. What that means, of course, is that the liver cell cannot produce fat, right? You got no glucose in there, you're not going to produce fat. So what internal starvation looks like is this. Because we know in type 1 diabetes, untreated type 1 diabetes, that the cell faces internal starvation, and you look like the patient on the left. So she's starving away. You can feed her whatever you want. She can't use it. and she basically wastes away until she dies. If you give her insulin, her cells now don't have the internal starvation, and she regains the weight. So great. We know that's what happens when the glucose can't go in. But this is what type 2 diabetes looks like, right? This is what we're calling internal starvation. There's something a little bit wrong with that paradigm of a gummed up lock and key system, because there's a paradox here that is not explained by this gummed up lock and key. Because if you look at this liver cell, okay, so insulin, it pushes the glucose into the cell. And if you're insulin resistant, it doesn't do that. So okay, that's great. But the other thing this liver cell is supposed to do is turn on production of new fat. So if you're insulin resistant, you can't produce any new fat. So like that untreated type 1 diabetes, you waste away. But that's not the case in type 2 diabetes. If the glucose is not going into the cell, how is this cell producing tons and tons and tons of fat? Because we know that the type 2 diabetes, the insulin resistant patient, has a lot of insulin resistance, has a lot of fatty liver. In fact, you always see the fatty liver, right? So how can this cell, the very same cell, the very same insulin, the very same insulin receptor, be resistant on the one hand to one of the functions and super sensitive to the other function? It's not correct. And we've based our entire treatment of type 2 diabetes on an incorrect paradigm. So what happens in this liver cell, of course, is that you have insulin. As you have insulin, it puts the sugar and the fat into the liver. So I've depicted the liver as a balloon, right? So it blows up when you eat. As insulin falls, it comes back out, right? That's all it is. It's a storage problem. But the problem with fatty liver is that if it fills up with persistent insulin, so if you eat a lot of glucose, if you eat a lot of fructose, you're going to fill up this liver cell, right? Because insulin, you're acting all the time. You're going to keep pushing it into storage. What happens is that you get fatty liver, right? That's not so hard to understand. But it's this fatty liver that's the key to understanding insulin resistance. Because if you have a huge fatty liver, that same dose of insulin is not going to be able to shove any more fat into this fatty liver. And if you don't have insulin, then all of this fat and sugar just comes whooshing back out, right? So the reason that you have the central paradox is because this is an overflow paradigm, right? The glucose can't go into the cell, but the fat keeps coming out. If the glucose couldn't go in, you couldn't make the fat. But it's not an underfilled cell, it's an overflowing cell, right? And this fatty liver precedes the diagnosis of type 2 diabetes because it's on that long, slow rise where you get the slow rise in the blood glucose, slow rise in the insulin resistance. So this is the Whitehall study, which shows you the time course of the liver enzymes before the diagnosis of type 2 diabetes. And what you can see is that they broke the group into two groups, one that eventually developed diabetes and one that eventually didn't. And what was the big difference? Well, if you look at the markers of liver tests, you can see that the liver is slowly getting distended and slowly getting inflamed. Those ALT, which is the marker of liver damage, is slowly going up. And what they called it is the long silent scream from the liver. You can't hear it. You can only see it on the blood test. You might be able to see it on CT or MRI. But it's this big fatty liver that's the key to understanding the insulin resistance. So it's really an overflow paradigm, right? So the cell is like this luggage, right? As you fill it up, it's harder and harder to put in more stuff. So at first, you can put in your clothes fine, but those last two T-shirts, you just can't shove them in, right? So you use more force, you use more insulin to keep shoving stuff in. But that's not the problem. The problem is not the insulin. The problem is that your cell is overfilled. It's an overflow paradigm. Just like this. Your cell is like a train, right? And it's got passengers, and normally they go in. Insulin opens the door, stuff goes in. But what happens if that cell is already filled, right? If it's already filled with glucose and fat, that liver cell, you keep shoving it in with insulin, that's not the solution, right? Because you have the wrong paradigm. You think that the train is not opening the door, so you hire these guys to keep shoving people in. They do this in Japan because it's cool. But the problem is the glucose stays outside, right? The passengers can't get in, so you keep trying to shove it in, which is fine at first. Then you go to the next stop, you hire more guys, right? Hire more insulin guys, keep shoving it in, right? And it works for the next stop. Then you hire more guys, you keep shoving it in until you can't anymore. Then everybody stays outside, you make the diagnosis of type 2 diabetes. So the key to understanding type 2 diabetes is it's all about the fatty liver, as Mark just talked about, right? The liver cell is just packed with fat. So you can't shove any more in. That's the whole point. In the meantime, the liver is busy trying to decompress itself of all this fat, right? So what it does, so it's making all this new fat through de novo lipogenesis, and it packages it out through triglycerides in the blood, right? And it's pouring out this triglycerides, and that's why de novo lipogenesis is so high. It's not resistant. Remember, this is the effect of insulin. It's super sensitive. It keeps trying to push it all out. So how do you get fatty liver? Well, it's not so hard in geese, right? This is how you make foie gras, right? So you take a goose, you shove a tube down its neck, and what do you feed it? Well, you feed it starch, right? Because you want the liver to make new fat. You don't make new fat by eating fat. Humans don't do that. The dietary fat does not go to the liver. It goes directly into the bloodstream through chylomicrons, into the thoracic duct, into the lymphatic system. But what happens is when you feed it starches, and fructose particularly, you get fatty liver. And that's what happens in humans as well. When you overfeed carbohydrates, glucose, and fructose, you get fatty liver. And that's how you get insulin resistance. So the key, again, to understanding this is that it's hyperinsulinemia, high insulin, but also this insulin resistance. That's the key to obesity. That's the key to insulin resistance. That's the key to everything. So if you eat a lot of fattening carbohydrates on the left, you can stimulate insulin, right? And that will lead to obesity. But high insulin levels over a long period of time are also going to stimulate fatty liver, right? As you produce this new fat through de novo lipogenesis, which is going to lead to insulin resistance, which is then going to lead to high insulin levels again. But fructose doesn't do this, right? So this is why everybody used to say, fructose, it's not that bad for you. Sugar is not that bad for you, right? Because fructose does not raise your blood glucose. It's a different sugar altogether. And it doesn't raise your insulin levels. So people said, great, fruit sugar, right? It's great. It's not great. The problem with fructose is the way it's metabolized in the body. It's metabolized solely in the liver, okay? So if you take sucrose, so sugar is sucrose, which is equal parts glucose and fructose. When you eat glucose and fructose, you have equal amounts. If you take an average size man, 170 pounds, you eat a pound of sugar. So you get half a pound of glucose and half a pound of fructose. 170 pounds of the glucose is metabolized by the body, okay? So every tissue in your body, every part of your body is going to use that glucose. But none of it uses the fructose, right? So that half a pound of fructose is metabolized by 5 pounds of liver, okay? So what does the liver do with it? Well, the liver could turn it into glucose, but you got lots of glucose. So it turns it into fat, right? So instead of 170 pounds of tissue using glucose, right? So your cells are kind of helping themselves to this all-you-can-eat glucose buffet. Nobody touches the fructose, right? So the fructose goes into the liver and gets turned directly into fat. So what it means is that if you only have 5 pounds of liver, using it, the glucose and the fructose are not equally bad for you. The fructose is like 20 times as bad as the glucose. So the starches, the rice and the pasta and stuff, that's all glucose. But the fructose is really where the money is. So glucose plus fructose is what gives you fatty liver, which gives you the insulin resistance. And what's glucose and fructose, right? It's sugar. And everybody knows this, right? Every diet says to cut the sugar. Even those diets that say, oh, you should eat starch. Oh, but by the way, you shouldn't eat sugar as well, right? Because the fructose is really the big problem, and it's the fatty liver. So that's insulin resistance. It's all about predominantly fructose, also glucose, and a lot of fatty liver. What causes this beta cell burnout? Doesn't it burn out? Doesn't it die out? Right? And that's why once you get type 2 diabetes, it's irreversible, right? Well, again, we know that's not true because we can prove it. If you look at studies on bariatric surgery, well, this is a study comparing medical intervention to bariatric surgery. So this is weight loss surgery. They cut your stomach to the size of a walnut, right? And then they rewire your intestines so you can't absorb what you put in your stomach. And what happens, of course, is that the people on the left started out with almost 3 diabetic medications. And very quickly, within 3 months, many of them were off all their medications with normal blood glucose. Their diabetes completely reversed. And this happens even far before much weight is lost, right? So if you're telling me that the pancreas is burned out, this tells you that you can take a man or woman with 20, 30 years of type 2 diabetes with 3, 4, 5 medications and completely reverse it, completely. Not just in one person, in everybody. And you can do the same thing with gastric banding. So again, if you look at their weight, it goes down. But if you look at their blood glucose, gastric banding is where you put a little, it's essentially a belt that cinches around your stomach so you can't eat. But again, you look at the blood glucose. When you start, it's 8, which is type 2 diabetes. Within a week, it goes down into the normal range, right? Again, before a lot of weight is lost. So this pancreatic beta cell that produces the insulin is completely functioning again. It wasn't burned out at all. And if you compare fasting versus bariatric surgery, you can actually get the exact same effect, right? So here's a comparison where they fasted people using a very, very low-calorie diet before and after surgery. The point of the fasting was not because they were very advanced thinkers. It was because they wanted to shrink that liver. Because when they do the surgery, if you have a big fatty liver, it's very hard to get in, hard to work things, right? So they know that if people don't eat, that liver shrinks right down, right? When that fatty liver shrinks right down, of course, the insulin resistance goes away because insulin resistance is from fatty liver. So you can see from the left-hand side, the weight loss, comparing the fasting to the surgery, and the fasting actually causes more weight loss. And if you look at the blood glucose, it gives you lower blood glucose, so it's actually better. And if you look at the counterpoint study, what you see is that the pancreatic fat slowly goes down. So your body, when it has nothing to eat, is pulling that sugar, pulling that fat preferentially out of the liver and then out of the pancreas because it's the fatty infiltration of these organs that is causing the type 2 diabetes. So as the pancreatic fat goes down, the beta cells recover. So they weren't burnt out at all, right? This is the restoration of the insulin response. They were merely clogged with fat. And that's tremendous news because it means that this whole notion, this whole paradigm, that type 2 diabetes is chronic and irreversible is completely untrue. It's a completely reversible disease. So the idea, the way you need to think about type 2 diabetes is basically like a sugar bowl. Your body is like a sugar bowl, right? It can hold a certain amount of sugar. But once it's completely full, as you eat the sugar, it just spills out into the blood. Remember, sugar, we're talking glucose and fructose. It spills out into the blood, right? And so if you have type 2 diabetes, somebody says, well, you have type 2 diabetes now. Let me give you insulin. Because we think that the sugar can't get into the cells, right? So we need to give you insulin. So what does that insulin do? Well, it doesn't get rid of the sugar in the blood. What it does is it takes that sugar in your blood and crams it back into your body, right? And then the next time you eat, that sugar bowl is still full. So you take more insulin, and then you cram it back into your body again. And your body takes it for a while, sends that sugar out into the eyes, into the kidneys. It turns a lot of that into fat, right? And you haven't fixed the problem. You keep doing this year after year. You take more insulin or drugs that stimulate insulin, and you cram it back into your body. And so what happens after 10, 15, 20 years? Well, your whole body just starts to rot. And that's what happens. Your eyes go, you go blind. Your kidneys go, you go on dialysis. You have gangrene and diabetic foot ulcers. Every part of your body has too much sugar. That's it. That's it. That's the whole pathophysiology. And what we've done is we've completely misunderstood the disease. Because normal is this, right? Normal is on the left. You have glucose, you have a cell, you have some glucose inside the cell, right? So if you think type 2 diabetes is about internal starvation, then the correct response is to give as much insulin as you need to shove that glucose from the outside inside. But if insulin resistance is really an overflow paradigm, then that treatment is completely, utterly wrong. Because you're taking that glucose from the outside and cramming it into the cell, which is now overfilled, has way too much glucose inside. And it's desperately trying to pump out this fat, right? It's the wrong treatment. And if you give the wrong treatment, guess what? Everybody dies, right? You get a huge worldwide epidemic of obesity, of type 2 diabetes, all because you didn't understand it, right? So if you think about this internal starvation model, we already know it's wrong. We've known it for close to 10 years. Because under this paradigm, you can take the insulin, shove it into the cell, and you will get better. But the Accord study showed that, yes, you can give people insulin and medications. What you see is that give you more medication, your blood glucose goes down, right? But remember, it doesn't get rid of the sugar in the body. It just crams it into the cell. And what happens? Well, you die more often. There's a 22% increased risk of death. And everybody says, well, there's this problem, that problem. But it wasn't one study. It was like 7 or 8 studies. The advanced study was the same. You can give medications to lower the blood glucose, but you can't make people healthier, right? And the VADT showed the same thing, the TICO study, the ELIXA study. There's study after study after study. And if you look at all of them, what you see is that when you take all of them together, they show you what you knew, which is that taking insulin doesn't make you any healthier. So the good news is that you can actually reverse type 2 diabetes completely naturally, as long as you understand this overflow paradigm. Because there's only 2 things you need to do. If your body has too much sugar, that's all type 2 diabetes is. Your body has too much sugar. Step 1 is don't put any more in, right? It's a low carbohydrate diet. That's why it works so well. That's why study after study after study shows the low carbohydrate diet works to reverse type 2 diabetes. It's not that hard to understand. So what's the drug equivalent of a low carbohydrate diet? Well, we have a drug that can block the absorption of carbohydrates. It's a drug called acarbose, right? So you take the drug, it blocks the absorption of carbohydrates, and the sugar doesn't go into the body, which is great, right? Because it's that sugar bowl. You're blocking, you're not putting it in. But it doesn't lower the blood glucose very much. And the other thing is that you get all this indigestion and so on, so people don't use this much. But there was a study in 2003, randomized study, 3.3 years of follow-up. And what you see is that you can reduce the risk of heart attacks and strokes, right, cardiovascular events on the left, by almost 50%, right? You're not lowering the blood glucose much, but you're lowering your heart attack rate by 50%. Because you're not putting sugar in to a situation where you have too much sugar. That's it. And what's step 2? Step 2 is you burn it off. If you have too much sugar in the blood, don't put any more in, and get rid of what you have inside. That's it. And that's intermittent fasting. So again, do we know it works? Well, of course we know it works. If you don't eat, your blood sugar drops, right? We know that. So what's wrong? What's wrong with that? Don't eat, blood sugar drops, don't take your insulin. That's it. But your body is getting rid of the sugar so that you're actually getting better from your diabetes. And we have a drug equivalent of this as well. So a new class of medications called the SGLT2s makes you pee out the sugar, okay? Pee out the glucose in the blood. And it doesn't lower the blood glucose a lot, but this is the recent study, EMPA-REG, was published, I think, last year. And what you can see is that this is the risk of cardiovascular events and what you see with the empagliflozin is that you can reduce the rate of heart attacks by 15 to 20%. Even though you don't lower the blood glucose, you're getting rid of the sugar in the body. And that's what makes you healthier, because that's the whole problem, right? So this is a very powerful paradigm, right? But we have to understand that this is not some kind of chronic, irreversible disease. And we tell people this all the time, right? You have obesity or insulin resistance, well, it's your fault, right? You ate too much fat, right? You didn't exercise enough. You should eat less and move more. It's your fault. That's what we tell people all the time. But it wasn't. It was really the failure of the doctors, of the researchers to understand that type 2 diabetes is not about too much sugar in the blood. It's about too much sugar in our whole body, right? That's what you need to get rid of. You can't simply take the sugar in your blood and shove it in your body and pretend that you're better. It's like if you have garbage in your kitchen, and instead of throwing it out, you throw it under the sink. Oh, great, my kitchen's nice and clean, right? And then, when there's more garbage, you throw it into your bathroom, right? Hey, great, my kitchen's clean, right? Your doctor pats himself on the back. Oh, you know, your blood glucose is so good, your A1C is so good, right? But what's the problem? You haven't thrown out the garbage, and your whole house just starts to smell, right? And then the doctor says, well, that's what happens, you know. It's chronic, it's irreversible. But it wasn't. We've proved it already. Why can't you accept that fact? You just have to know how to treat it. But again, the opportunity before us is enormous, because we have now the possibility that you can actually just completely cure the whole damn disease, right? And if you think about it, it's an incredible notion. Because if you don't have diabetes, then you don't have diabetic nephropathy, that's kidney disease. You don't have to do dialysis, right? If you don't have diabetic foot ulcers, you don't have any blindness from type 2 diabetes, right? You don't have heart attacks, you don't have the strokes, you don't have the cancer. None of that, right? And it's all available to us without any drugs, without any surgery, and without any cost, right? If you don't eat, you don't have to pay for food, right? You're saving money, right? What could be simpler? And you're treating your type 2 diabetes, right? So this is the whole idea of this conference, is that these diseases, which cause so much pain and so much suffering, and we've treated them for so long with the wrong paradigm, right? Just take your medications, right? No, that's not the case. This is a dietary disease. It demands a dietary solution, right? And that's all. That's all we need. And we can do it. We can do it anytime we want to, because as long as you have the knowledge, you don't need the infrastructure, you don't need the hospitals, you don't need anything, you don't need any infrastructure, you can do it. In that world that we can see it now, that world that is free of type 2 diabetes and free of all of these heart attacks and strokes and all of that. It's there, right? But it's not up to me, or Marianne, or Gary, or Jeff, or Rod. It's up to you. It's up to all of you to tell your friends, your families, yes, your doctors, like Sam said. Tell your doctors. And if your doctors, tell your patients. It's all here for us. It's all here for the taking, right? And we can see it through that open door, right? David sees it already. He does it already. You can see it through that open door. And we just have to walk through that threshold. We're inviting you to come walk with us through that threshold to that world. Without diabetes, without pain, without medication, without insulin. And guess what? That world starts today. Thank you.